Hello, and welcome to today's webinar hosted by the Pediatric Brain Tumor Foundation alongside the National Brain Tumor Society. Today's topic is understanding biomarker testing, what you need to know about personalized treatment for pediatric brain tumors. My name is Heather Held, and I'm the Director of Family Support for the Pediatric Brain Tumor Foundation. We thank you all for joining us today for this important subject. Before we get started, I do have just a few housekeeping items to review. You are muted for this webinar and your video is disabled, but we welcome questions during and after the opening remarks. You can type your questions into the Q&A feature found at the bottom of your Zoom window. We will not get to every question, but we will try to get to as many as possible today. I'm pleased to welcome three very important voices in today's conversation. Dr. Andrew Rankin, Director of Precision Medicine at One Biopharmaceuticals, parent advocate and father of Marin, Jeremy Nemeth, and Senior Director of Community at the National Brain Tumor Society, Jenna Tozzi. Andrew is currently Director of Precision Medicine at One Biopharmaceuticals, where he's worked over the past 4 years to help develop novel treatments addressing unmet need in pediatric brain tumors. Prior to Day One, Andrew worked in multiple capacities at Foundation Medicine, leveraging his expertise in cancer genomics to help doctors understand the results of genomic sequencing of their patients' tumors. He loves teaching and enjoys meeting people where they are to make complex scientific topics accessible for all. He also has a profound passion for addressing unmet need in childhood cancer broadly and has focused his professional career towards this goal. Bringing these two focuses together, Andrew hopes to help families and caregivers of children with cancer better understand the scientific complexities of childhood tumors so they can be more comfortable asking the right questions of their doctors. Jeremy Nemeth is a longtime supporter of PBTF and the father of a 14-year-old diagnosed with a low-grade glioma. He works as a professor at the University of Colorado and lives with his family in Denver. Some of his favorite things to do are watch Marin play volleyball, coach his son Luca's baseball team, hike with his wife Leslie, and travel internationally with the entire family. And finally, Jenna Tozzi is the Senior Director of Community at the National Brain Tumor Society, bringing 15 years of experience as a multi-state registered nurse dedicated to the rare disease and oncology communities. Jenna has developed nationwide navigation programs and at expanding access to clinical trials and improving patient outcomes. She is passionate about empowering patients and families to overcome barriers to care while ensuring their voices are heard throughout their healthcare journey. It gives me the greatest pleasure to welcome these presenters today, and I will turn it over now to Jeremy.
Hi, everyone. Welcome, and thanks for being here today. This is my daughter, Marin, and I'm going to talk a little bit about her today. So she was diagnosed with a brain tumor on August 7th, 2016 at age 5.5. We've been living in Barcelona for a year, and near the end of our time there, she began to have some non-specific symptoms, things like headaches, nausea, and just general lethargy. We had just returned to the US that August, and Marin was so excited to start kindergarten a few days later. But right around that time, her symptoms began to worsen. So we took her into the ER here in Denver and pushed hard for, at the very least, a CT scan after months of checkups and check-ins. That day, we received the worst news any parent obviously can ever hear. Your beautiful daughter has a very large mass on her brain. So today I'm going to talk a little bit about Marin's story, just to really ground this discussion in some reality and to remind ourselves that what we're talking about is some pretty precious humans here, just like my Marin. So over to you, Andrew.
Thank you, Jeremy. Before we get into the presentation, Jeremy, I was hoping you could just talk for just 1 or 2 minutes about, when you found out that Marin had this large tumor in her brain, and you went through the very difficult process of undergoing surgery to have the tumor removed. What kinds of conversations did you have around biomarker testing of the tumor at the time, recognizing that this was, almost 9 years ago?
Yeah, really the only thing that we had talked about this is 2016. I remember her oncologist who was also a researcher at Children's Hospital, and he said these words, he said, "We are working on some medicines here. We're testing some things. There's some industry folks that are testing things. And if this tumor ever tries to grow back, someday there might be this pill that Marin could take to stop this thing in its tracks." And I remember thinking that was some like science fiction, futuristic prophecy sort of thing. Like, yeah, sure. That means like curing like cancer kind of stuff. Like, okay, we'll believe it when we see it. But really that was all that was talked about. And then the only testing that was actually done at the time was for really these two common biomarkers. So there's the KIAA 1549 BRAF and then the BRAF V600E. That was the sort of by rule stuff that they tested for. And really the sort of like next generation testing that exists now, at least as far as I understand, didn't exist at that time. So they sent that away. She was negative for both of those. And it was considered something like a juvenile pilocytic astrocytoma, a JPA, with really common pediatric tumor type, most often located in the cerebellum. And that was the sort of closest we had at the time. And that was really the only discussions we had in 2016.
Yeah, thank you. And I think that's a perfect transition for today's talk. Jeremy, I can imagine that even though, that was 9 years ago, I would imagine that plenty and a lot of caregivers and parents today probably have the same questions and probably have the same, wonderings about what's going on in their child's brain tumor. How can they figure out what may be going on so that that can potentially guide, treatment decision making with their doctor? And so, with that transition, let's go into for everyone on the call. You're joining the webinar to learn about biomarker testing in pediatric brain tumors. And as Heather said, I'll do a quick intro again. I'm Andrew. Nice to see everybody. And it's my pleasure to do this webinar with the Pediatric Brain Tumor Foundation in collaboration with the National Brain Tumor Society and Jenna, who's also on the call, and to present this with Jeremy. It's been wonderful meeting with everybody, and I think this is a very important topic that a lot of people have questions about, but has been changing so rapidly that it can be often very difficult to keep up. So some of the topics that we're going to talk about today are not necessarily just for children with brain tumors. I think as everyone kind of sees what we learn about with biomarker testing and childhood brain tumors, that you can apply a lot of these learnings to other types of tumors also. And so for anyone who's watching, especially when it goes up on YouTube later, take some of these principles to heart to understand that it's not just necessarily for children with brain tumors, but they can also be applied for a lot of different tumors as well. So as we get into it, I have to give a couple disclosures. One is that the contents of this presentation and the commentary provided reflect the presenter's individual opinions, that's me, and do not represent the opinions of Day One Biopharmaceuticals, my employer. The second one is also really important to Andrew, myself, is I'm not a medical doctor. I'm actually a PhD doctor. So I am trained in science and not in medicine. So because of that, I won't be able to answer questions today regarding specific treatments or treatment plans or biomarker testing results. Any of those kinds of questions should be done with your child's doctor. And the most and probably the most important thing too is everyone, we will have a Q&A session at the end of the webinar. And I recognize that we have quite a diverse audience who's attending now and who may be watching online later. And that could include healthcare professionals, caregivers and families and parents. For the questions that come in that are of technical nature, I'm going to do my best to be able to answer those in caregiver and parent-friendly language so we can hopefully make these topics accessible to everybody. So with those disclosures out of the way, what are we going to learn about today? There's a number of things. To understand biomarker testing in childhood brain tumors, we're going to go very basic. We're going to learn about what a tumor is and how a tumor works. We're going to understand what biomarkers are because we use the word biomarker testing. What do we mean by biomarker? Why does it matter? Then we're going to understand and learn about how biomarkers are tested for. What are the different processes? How does your child's doctor order the testing? How long does it potentially take? We're going to understand a little bit of that process. We're going to take a break at that point, and we're going to hear from Jeremy again. And he's going to talk to us a little bit more about that testing that they did on Marin's tumor in 2016. And hopefully, after learning about some of these terms and topics, you may have a better understanding, even yourself, about what questions you may be able to ask your doctor about biomarker testing. We're going to talk about some examples of biomarkers in different types of pediatric brain tumors. And we can't talk about all the different kinds of brain tumors. There's many dozens and dozens of brain tumors that are known. We're going to talk about specific examples and why those biomarkers can provide information for you and your doctor in terms of understanding the tumor better. We're going to close this part out with personalized treatment. Today, the science and medicine of targeted therapies and cancer therapies is progressing so fast. It's creating this world of what we call personalized treatment. It's about understanding what's happening in a particular tumor, in this patient's tumor, in your child's tumor, to help develop potentially a treatment plan that might be best for your child and their tumor. And the last thing we're going to talk about is questions that you can potentially consider asking your child's doctor about biomarker testing. And they're the kind of questions that are really, we'll call universal. So it's the way in which your doctor may go about testing the tumor to understand new information. So we have a list of questions that you can consider thinking about asking your doctor, and we'll talk to Jeremy too about his thoughts on that as well. So let's go right into it, if everyone's okay with that. And we're going to talk about a tumor. At its most simplest form, a tumor is a lump or growth that's made up of cancer cells. And those cancer cells are growing and dividing more than they should. And so in this colorful picture, you have these normal looking cells, and then you have this tumor with these cancer cells right here in the purple, this purple lump or this purple blob. The thing about tumors is that they can form in almost any part of the body. So you can have a tumor in your stomach, in the large intestine, in the kidney, and of course in the brain, which is the focus of the talk today. And this is to emphasize that tumors can really form really anywhere in the body. And it comes down to how changes occur in these normal cells to create the development of a tumor. So how does a tumor work? How does a tumor begin to develop? Well, a tumor can form when changes happen inside a normal, healthy cell that cause them to lose control over how they can grow and divide. So here's this colorful picture of a healthy cell, and that healthy cell will grow and divide into more healthy cells. But the important thing to think about here in a healthy cell situation is that they're growing and dividing carefully. And so when you have normal cells growing and dividing carefully, they can form healthy tissue and then a healthy organ. And this can really be thought about in any organ in your body, your skin, your stomach, your esophagus, your intestines, and even your brain. And so in a normal situation, when cells are growing and developing tissue and they're allowing an organ to be very healthy, we use the word carefully here. However, there are times when changes can occur in healthy cells, and those changes can, if they happen enough, and there's enough of them in specific changes that occur, they can cause a healthy cell to develop into a cancer cell. And this is when cells become sick, and they can begin to lay the groundwork for developing a tumor. All those changes that are happening are allowing that cancer cell and the groups of cancer cells that it helps develop to grow out of control. So it's when they're losing the ability to control how carefully they grow is when you get the groundwork for a tumor to form. And so here you can see this nasty looking red little blob of cancer cells that are beginning to form a teeny tiny little tumor. Now, the challenge and the problem is that depending on where that tumor grows in the body, depending what organ it's growing in, the larger that it grows, the more likely that it can hurt that organ that it's in. And so in this picture of this brain, this illustration picture of this brain, look in the magnifying glass, is this small tumor that's growing. Now, the thing about the growth of these tumors is the reason they cause problems in the organs they grow in this case, the brain, is because they get larger and they start impacting the ability of that organ to do what its normal job is. So in the brain, depending on where the tumor forms, you can have troubles with the function of that part of the brain. And sometimes with some caregivers and families, you may notice over time things like if your child isn't able to hold a pencil the way they used to, or if there's some challenges with balance that were unexpected or kind of came out of nowhere. If the tumor is forming in a part of the brain that affects vision, you might have suddenly a situation where you see your child unable to see their iPad unless they hold it very close up to their eyes, or the TV, or a book. And so a lot of these, if it's due to a tumor, can be because the tumor is growing in size and it's pushing against those parts of the brain that control those different functions. So we talked about the changes and that they occur in normal healthy cells that can cause them to turn into cancer cells. There's another term for those. We call those drivers. And so drivers are these things. They are the changes that we're speaking to. And the word driver should be read as it is. It's pushing the growth of that cancer cell, of the tumor. It's driving forward that growth. And these drivers have been studied in different kinds of pediatric brain tumors over the decades of time. And all the research that you hear about, the clinical research, the scientific research that's being done in childhood brain tumors, for instance, is trying to identify what these drivers are. If you can identify the drivers that's causing these tumors to grow and survive, maybe you can develop a medicine to stop it. So the drivers in a child's tumor can sometimes give important information to their doctor. And it's this kind of information that your child's doctor can use to better understand what your child's tumor is doing and what's causing it to survive. And that can sometimes help a doctor understand how to develop a personalized treatment plan. But here are what some of the drivers can actually, if you know the driver of a tumor, sometimes they can help determine a diagnosis of the tumor. They can also help understand how aggressive the tumor may behave. Depending on what kind of drivers are in a particular tumor, it may make the tumor grow faster or not quite as fast. And that can help understand how quickly the tumor may be growing, which can then potentially help your doctor understand, okay, here's the kind of treatment plan we may want to think about. And then this is kind of what I've already mentioned a couple of times, but understanding the drivers in your child's tumor can also help determine a specialized treatment plan. Now, when a driver does give information to you and your doctor about understanding how this tumor works, and it informs how the treatment plan might come about, we call those drivers biomarkers. And so biomarkers brings us back to that conversation we had with Jeremy just a couple minutes ago about biomarker testing. So understanding the biomarkers that are driving your child's brain tumor is why we're here today. And understanding how to ask those questions about what biomarkers are happening in your child's tumor and how can we potentially look for them. To understand biomarkers, we have to do biomarker testing. And this is the crux of today's webinar. To learn which biomarkers may be drivers of your child's brain tumor, their doctor will have biomarker testing done, if possible. And we're going to understand in a little bit why we say, if possible. So here's at a very, very high level, sort of the process that typical biomarker testing takes when there's tissue available to do the testing on. So if possible, tissue from your child's tumor is removed through surgery or through biopsy. A specialized doctor called a pathologist will look at that tumor tissue under a microscope. They'll try to figure out what type of tumor it is. This leads to a diagnosis. The pathologist also does the biomarker testing on that tumor tissue. And that biomarker testing is exactly what it is, exactly what it says. They're looking for those biomarkers to help understand what may be happening inside of that tumor. At the end of all of this testing process, your child's doctor gets a report. Your child's doctor and care team gets a report with the diagnosis, and then any biomarkers that may have been found as a result of doing that testing. So a really important point here, though, that when and if you're able to ask your doctor about biomarker testing that you need to know about. In this world of biomarker testing, sometimes doctors can use different terms that all mean the same thing. One of those is molecular testing. If you hear this term, we're going to do molecular testing, it probably means they're doing biomarker testing. Another term, and these are somewhat mouthfuls of terms here, but just so you can have these here, you can write them down. And so when you hear them, you can potentially remember, oh, they're talking about biomarker testing. The second one is genomic testing. If you hear that there's genomic testing being done on your child's brain tumor, it is almost certainly going to be biomarker testing. So it's important to know that sometimes there's different words that can be used that all talk about the same general thing. An important point here too is that depending on where your child may be seen and treated and cared for, tumor biomarker testing is not necessarily done the same exact way at every treatment center. So here we have a picture of Pediatric Brain Tumor Treatment Center 1. And at this treatment center, this is how they go about doing the biomarker testing. And these are examples, by the way, these are not exhaustive examples. These are just a couple of illustrations and examples of how some brain treatment tumor centers may do this kind of testing. So here's an example. If the doctor has an idea of the brain tumor type, a test may be ordered to look for a single biomarker common to that tumor type. So perhaps the doctor thinks it's going to be a pilocytic astrocytoma, but they want to do just one single biomarker test to look potentially for a BRAF biomarker, and they want to see if that biomarker is present in this tumor. If it's a positive result, that may help your doctor develop a treatment plan. If it's a negative result, meaning it came back and there's not that biomarker present, then they may do more testing. They may order a second test to look at a bunch of biomarkers all at the same time. Now, this could be different than another pediatric brain tumor center, such as this one. At this treatment center, perhaps whether or not your doctor may have an idea or the pathologist may have an idea of what kind of tumor it is, they may order biomarker testing that looks instead for many biomarkers all at the same time in the same test. Depending on the results of that, they may order more biomarker testing, or they may use those results to help develop a specialized treatment plan. The most important thing, though, to understand about tumor biomarker testing and sort of how it's done is that even though there are differences between some treatment centers, there's not a right or a wrong way to do biomarker testing. There's different factors that come into play that can help determine what kind of testing your doctor may want to do. What are some of those factors that we're talking about that can influence the kind of biomarker testing done? One of them is understanding the type of brain tumor and what treatment options may be available. So if your doctor knows that this particular type of brain tumor that your child may have or may have been diagnosed with, if there's known medicines that have been that are available for that tumor, perhaps they'll do testing to see if the tumor has the right biomarkers for those medicines. So this may be influenced by the type of brain tumor. What's another reason that there could be differences in testing? Well, this is a big one. How much tumor tissue is available? Not all brain tumors are the same size when they're cut out with surgery or when they're biopsied. There may be a very, very small amount of tumor tissue available to do the testing. And so your doctor needs to figure out what may be the best test to do with limited tissue and what kind of results can we get from that test. Another factor is how long it may take for the testing to occur. Not all biomarker testings are created the same in terms of how long it takes. Some biomarker tests can give results within a day. Some results can give within 2 days. And there's some more complicated testing that can take up to 2 weeks. So how the biomarker testing is done at different types of treatment centers is not right or wrong. There's a lot of reasons that go into figuring out what the best testing will be and what kind of results it might bring to help your doctor identify a specialized treatment plan. So one topic we're going to talk about here at a very high level is there's almost certainly a chance that you may hear the term genetic testing. This is a very common term that you can be hear that you may hear from your doctor, or through as you're reading different resources that may come up. You may hear these terms, biomarker testing and genetic testing. Well, there is a real difference between the two. They're very different in terms of what kinds of information that they can bring. The simplest way to think about this is that biomarker testing in general determines if your child's tumor has a specific biomarker. This is very different than genetic testing. Genetic testing determines whether your child was born with a specific biomarker. And so these are very different tests that can be done, but it's an important conversation to have with your child's doctor as to whether or not they think it's important to do biomarker testing only or to do biomarker testing and genetic testing. There's a lot of implications in that, and it's important to understand that there are different types of testing, and it's a really important conversation to have with your child's doctor if you hear the words genetic testing. With that being said, we are now going to, Jeremy, if you can come back on, now that we've kind of talked through what a biomarker is in a tumor and biomarker testing in general, Jeremy, I'm wondering, can you talk us through, in 2016, when Marin had her surgery and had the tumor removed, sort of bring us back to that moment and talk about that testing conversation. You highlighted it earlier, but now that we've talked through biomarker testing, bring it back to us again. Let's revisit it.
Yeah, absolutely. So this will be the first update on Marin, and some of this again will be repetitive for those who are here from the outset. But I do think it's helpful, as you said, Andrew, to go through this one more time now that you have that, now that the audience really has that context that I think is wonderful, and I learned a lot. But the context that you provided. So just 2 days after the discovery of her tumor in 2016, Marin had surgery to remove the tumor. So that's the first update. The surgeon was able to perform a gross total resection. So basically all of it was removed, and she had no deficits or impacts or surgical complications. The basic pathology at that time, I guess the biomarker testing showed that she had really this generic low-grade glioma with similarities, as I said earlier, to a juvenile pilocytic astrocytoma or a JPA, which is very common. The signs were that it sort of looked like that, but that's really all they could tell. The hospital sent the tumor away for this biomarker testing to look for the two BRAF biomarkers only, and she was negative for both, meaning she did not have either of those biomarkers. And as I said earlier, I remember then that her oncologist said, someday we might be able to develop medicines that can actually address and arrest those processes of growth if we're able to identify those biomarkers, and particularly the most common ones. And so I remember at that time being blown away by that, but here we are 9 years later, and we're learning a lot more about that, and things actually exist. Marin recovered very well, so you'll be happy to know. And she started kindergarten just a few days later. But her story isn't over, and I'll give you a final update on the next round of Marin's story after Andrew goes through, I think, 4 or 5 more slides. So I'll turn it back over to you, Andrew.
Yeah, thank you, Jeremy. And the reason we wanted to revisit this for everyone on the call is exactly to Jeremy's point, to revisit that testing, journey at the time in 2016. And it's also important to note that today, in 2025, 9 years later, testing has expanded for sure in terms of what doctors are able to test for, depending on the type of tumor and all those other factors that we talked about. But also that there's importantly, some of the types of testing that were done in 2016 are still done today. And so that's also what I meant earlier on that slide where I said there's no right or wrong way for this biomarker testing to be done. And it's important to understand the way that your doctor is thinking about it for your child's brain tumor. And so with that, we're going to talk about some examples of biomarkers in pediatric brain tumors. I mentioned earlier that there's many dozens of different kinds of pediatric brain tumors that have been described, but depending on which one you're talking about, the biomarkers of one child or brain tumor can be very different from another kind. So that's why there's so many different kinds of different brain tumors. It depends on where they started growing in the brain, and it depends on what kinds of biomarkers and drivers are pushing that tumor to grow and to develop. Some examples, then, and Jeremy mentioned this one, is low-grade glioma, where the biomarker, or a biomarker, is BRAF. Another example is high-grade glioma, where there's a biomarker H3K27M. Medulloblastoma, one example, CTNNB1, and then ependymoma. In this example, this mouthful, ZFTA-REL-A. The reason we're showing this slide is to show that the biomarkers, again, of one childhood tumor are different between each other. They're not the same. And that's why the importance of testing is so real at this point, to understand what biomarkers are in your child's tumor, or what biomarkers may be in your child's tumor, is the result of doing the testing, the biomarker testing. And we're going to talk a little bit about these now. Let's look at pilocytic astrocytoma. This is a type of pediatric low-grade glioma, of which there's many different kinds. It's usually found in the cerebellum, which is the bottom back part of the brain, in this little red circle area, but sometimes in other parts of the brain. So this is an important part too, that not all specific types of brain tumors are always found in the same area of the brain. There are some times when pilocytic astrocytoma may be found in other parts of the brain as well. The most common biomarkers that are known are changes to the BRAF gene. And those changes is usually a BRAF fusion or a BRAF V600E. Now, we're going to use the terminology that we've learned today. We can call BRAF fusion or BRAF V600E biomarkers, but guess what? They're also drivers. They're key drivers of pilocytic astrocytoma. They are those changes that may have occurred at some point to create a cancer cell that then developed ultimately into a tumor. And so that's why we started the presentation with understanding that changes happen. Those changes are called drivers. And when those drivers help your doctor potentially understand the tumor and develop a specialized treatment plan, we call them biomarkers. Now, a BRAF fusion or a BRAF V600E biomarker that may be identified in your child's pilocytic astrocytoma using biomarker testing may help determine treatment options for your child. Another example is medulloblastoma. Now, this is a more complicated tumor. They're usually found in the cerebellum, but sometimes they're found in parts of the brainstem as well. Now, here's the thing. For medulloblastoma, pediatric medulloblastoma, there's 4 main types. And I'm going to put them all down here, and then we're going to talk about them for just a couple seconds. One of those types is the WNT subtype. One biomarker change is a change to the CTNNB1 gene. Another subtype is called the SHH subtype. This is very different. A known biomarker is a change to the PTCH1 gene, as well as the TP53 gene. The group 3 subtype, a known biomarker, is a change to the MYC gene, MYC. And then the group 4 subtype is a very complicated, not well understood subtype where the biomarkers are still being understood and discovered. Now, this is a lot of potentially word salad with all these acronyms of all these words, WNT, SHH, CTNNB1. The important thing here is we need to talk about how these 4 main subtypes of pediatric medulloblastoma were discovered. These were not all known originally. It took years and years and years of scientific research and clinical and medical research to identify these 4 subtypes. So the SHH subtype, for instance, was originally identified in the early 2000s. Then in around 2010, right around there, the mid 2000s right there, is when it was understood after all this medical and scientific research that there's actually 4 main types of pediatric medulloblastoma. And all 4 types have different kinds of biomarkers. That's what helps separate one type from another. Now, zoom forward to 2017. So what is that? 8 years ago, around 2017, as the result of even more scientific research, These 4 subtypes can now be broken down into even more. And so with pediatric medulloblastoma, there's actually 12 distinct subtypes of pediatric medulloblastoma. And they're all differentiated from each other. They're all different from each other because of the different biomarkers that have been discovered in those different subtypes. And knowing which subtype your child may have if they're diagnosed with a medulloblastoma can help identify a specialized treatment plan. But all of that comes down to biomarker testing. And so the biomarkers found in your child's medulloblastoma using biomarker testing may help their doctor understand how aggressive the tumor may behave, or that may help determine treatment options. And so this really helps to kind of, I hope, send home the point that no matter what kind of brain tumor your child may have been diagnosed with, it's important to try to understand, if possible, what biomarkers are in this tumor, what's causing it to grow, what are the drivers, and that may help inform how aggressive the tumor may behave or potential treatment options. Another example is pediatric ependymoma. Now, there's a couple different areas in the brain where ependymoma can form depending on the subtype. And it's kind of similar to medulloblastoma, where there's a couple of different subtypes. Now, there's not 12. There's actually 3 right now that are understood. One is called the ST subtype. And 2 of the biomarkers that have been discovered in the ST subtype is, again, another mouthful, but it's a ZFTA REL-A fusion. Another one is a YAP1 fusion. These kinds of biomarkers can potentially be identified with biomarker testing. The PF subtype, there's 2 biomarkers that have been identified. One is this big mouthful called a methylation phenotype, and another is a change in the EZHIP gene. And this is not necessarily something that I want anybody watching this to memorize or to learn specifically, but to understand, again, that the biomarkers in different pediatric brain tumors are not the same. Depending on where the tumor was formed, depending on how it developed, there may be different biomarkers. And so it underscores the importance of doing that biomarker testing. The SP subtype is very rare in children, and the biomarkers are not very well understood. So with ependymoma, you can see here the language that we're using is very consistent and almost the same as what we said with medulloblastoma and even pilocytic astrocytoma. The biomarkers found in your child's ependymoma using biomarker testing may help their doctor understand how aggressive the tumor may behave. One last one we'll go through is diffuse intrinsic pontine glioma, DIPG. It's a type of pediatric high-grade glioma found in the bottom of the brain in the pons. And some of you may be familiar with this biomarker, H3K27M. It's a mutation that's in the H3F3A gene. Understanding these biomarkers, even this very specific one, if it's identified in your child's DIPG, it may help through the process of biomarker testing your doctor to understand how aggressive the tumor can behave or help determine treatment options. Now, with kind of working through these different biomarkers in pediatric brain tumors, we're going to bring us to the last slide before we turn over to Jeremy again. We mentioned personalized treatment earlier on in the webinar. Personalized treatment is the result and can be the result and can be helped to understood by biomarker testing. With the biomarker testing, there are times when certain targeted therapies may be identified. A targeted therapy is a type of treatment that attacks tumor cells that have a very specific biomarker. So you would only apply a targeted therapy if a tumor was found to have the right kind of biomarker. This also is true for immunotherapy. Because of some types of biomarker testing, it can give your doctor information that may help develop the personalized treatment plan that involves immunotherapy. And this is where it's a type of treatment that helps your immune system attack tumor cells. Radiation therapy is a type of treatment that uses high energy beams to attack tumor cells. And non-targeted chemotherapy is a type of treatment that attacks cells that are growing and dividing. Now, these are just examples of some certain types of treatments that can be informed by biomarker testing. But that's why it's so important to try and understand, if it's possible, what biomarkers may be in your child's brain tumor. And it can spur some of those questions to ask your doctor about. We're going to turn it over to Jeremy now, because we're going to hear an absolutely heartwarming update on Marin and how she's doing, as well as some of the new things, Jeremy, that you found out about her tumor.
Yes, absolutely. So we dip a little bit and then we'll come back, I promise, in terms of positivity. So about 4 years after the tumor was removed, it was August of 2020, and Marin had had 4 years of clear scans, no regrowth. This was supposed to be the last MRI that she would ever have before she got this lifetime sort of all clear. But that scan showed what looked like maybe a very small amount of tumor regrowth. And of course, this was surprising to us. It was devastating to us, mostly because we had been under the impression, and the medical team had too, that JPA-like tumors, the juvenile pilocytic astrocytoma tumors, that are totally resected, totally removed, do not normally grow back. But unfortunately, this seed of a new tumor did grow slowly until it grew quickly. And a few years later, at age 13, Marin had her second surgery. So that was 1 year ago this month. Part of the rationale for proceeding with another surgery, though, with the team was really not just to remove the tumor safely at the size it was, which was much smaller than the original baseball-sized tumor, but also to be able to do that full genetic or that molecular testing to figure out just why this thing grew back in the first place. So August 12th, 2024, she had another successful surgery. Again, what they considered to have been a gross total resection. She started 7th grade the following week. A pretty remarkable recovery once again. And this time, her team advocated for this full next generation genetic testing on her new tumor sample. And so about a month later, her tumor testing came back, and they determined that it was not actually a JPA. They now characterize her tumor as what they call a low-grade neuroepithelial tumor, and that the biomarker that was causing this was called a PATS1 fusion, a very rare fusion, initially, at this point at least, associated with a pretty good prognosis. But this particular mutation does have these characteristics that we know make it likely for the tumor to grow back if any cells are left behind during surgery. There's only about 20 or so cases of a particular fusion that have been documented. There are 2 research papers that exist on the subject, both published in the last year. But really what this knowledge did was give us a much better idea both of her prognosis as well as the most effective steps if her tumor does grow back yet again. I can tell you today, as you see, Marin is doing incredibly well. She's still asymptomatic. There's been no tumor regrowth in a year's worth of scans since that last surgery. She plays high school and club volleyball. She's a lead singer in a rock band. She serves as a patient ambassador at Children's Hospital Colorado. She's led her own funding efforts for PBTF. And most importantly, she continues for us to be the most courageous, empathetic human you'll ever meet. So I'll give one last update at the very end and just some ideas of kind of where we are right now. But Andrew has just a couple more slides.
Yeah, thank you, Jeremy. And I think it's so important to know too that, over the past, 9 years since Marin was first diagnosed and had her first surgery and had that biomarker testing done, the amount of scientific research that's been done, even on these very rare neuroepithelial tumors, is amazing. And so in today, in 2025, we can say that we know more about that fusion. We can say that, we understand more about how it's going to make a tumor behave. We can understand more about what new research is still needed to potentially find a medicine that can target that particular fusion. And so this really does underscore the importance and need of nonstop research, and development to better understand what these biomarkers are that are driving all these different kinds of pediatric brain tumors. And then once understanding those biomarkers in depth, we can then start to think about how can we develop medicines for them. And so thank you, Jeremy. With that being said, what did we cover today? We're going to come to a summary of these different words and terms and concepts. And then we're going to go over after this slide some questions that, you as a parent and or caregiver can think about asking your doctor, your child's doctor, about biomarker testing. And it's not one where you have to ask all the questions. You can ask one or two or three, but it's important to start that conversation to say, how are we going to understand our child's brain tumor? So what did we cover today? We understood and learned that a tumor is a lump or growth made up of cancer cells that are growing and dividing more than they should. Drivers are the changes that turn a healthy cell into a cancer cell and that help the cancer cell grow and divide out of control. Tumor drivers of one childhood brain tumor can be different from another kind. When a tumor driver helps a doctor better understand treatment options, we now call these biomarkers. Biomarker testing, when possible, is done on tumor tissue to learn which biomarkers may be drivers of your child's brain tumor. Biomarker testing is diverse. There's a lot of different kinds of biomarker testing available, and it's not necessarily done the same exact way at every treatment center. Remember, I mentioned that before. There's not a wrong way or a right way to do biomarker testing because there's all those different factors that come into play to help you and your doctor decide what's the best way to move forward with the kind of brain tumor that our child has. When the biomarker testing on your child's tumor tissue is complete, and if it's used to develop a specialized treatment plan for your child, it's an important piece of the personalized treatment puzzle. So that is, in summary, the different concepts and topics that we learned about today. And now we're going to go to those questions. And then we're going to ask Jeremy for his thoughts too as we work through these. So again, this is not a guide where every one of these questions has to be asked. It just gives you as a parent or giver some understanding of what kind of questions might be important to ask if you want to understand a little bit more about how your child's tumor may be tested. So the first question, are we able to have biomarker testing done? Because remember I said it's not always possible. So it's important to have that conversation. What kind of biomarker testing might be done if possible on my child's tumor tissue? Is there enough tumor tissue available for this testing to be completed? How long does it take for the results to come back from any particular biomarker testing? Will those results, those biomarker testing results, help us understand what kind of treatment options might be available? And if the results come back and they're either unclear or they may not give a complete picture of what's potentially happening in my child's tumor, are there other types of biomarker testing that can be done? And so, these are just some of the examples of questions you may consider talking to your doctor about, your child's doctor about. And Jeremy, I'd love your thoughts here. Like, are these some of the questions that you asked, or what kind of questions are top of mind for you?
Yeah. No, they are. And I think I have this very unique experience of being a caregiver for someone who has had two sort of distinct experiences, related but distinct experiences over the last decade when things have developed pretty remarkably in this field. And so being able to sort of compare those two processes. The first time around, it was very much, like I said, this sort of futuristic that might happen at some point. And right now, we know that there are these two common biomarkers that are both BRAF related. We tested for those. Turns out it's not that. So we're going to lump Marin into this sort of like low-grade glioma area and hope that this thing doesn't come back. And now, part of the impetus for the actual second surgery was really about um, understanding more why this is growing back, what the prognosis is, and just giving us so much more information, both as a family, but also to develop a personalized treatment plan. And right now, because of the rarity of what's happening, or of Marin's tumor type, there isn't something that exists there isn't a medicine that exists to address this. But I just want to kind of talk about that because I think, Andrew, you mentioned something that was really important that I've kind of come to recently, in understanding that that even if the testing determines now that there isn't currently a targeted treatment for your child's situation, there could be in the future. And the fact that Marin's fusion in this case is considered very rare doesn't mean that it's necessarily as uncommon as we think. And I know that's kind of confusing, but the way I understand it is that in many cases like ours, the process of identifying the biomarker simply just didn't exist until recently. So its rareness could also just be could be a reflection of us not being able to test for that mutation until now. And so that's what I think is so remarkable, is that the science is developing as we speak. It's literally like right now. And I saw a question come up about this. And so I would encourage all of us to continue to fight for that funding that clinical and scientific researchers need to ensure that our knowledge on the drivers and their cures continue to develop. And I mean, as we see, and why I'm here is because there are children's lives here at stake. And if we're not, if that doesn't cause us to act in whatever way that we feel the most useful in this, then I don't know what else will. So I just wanted to underscore that point, that like where we are in this history it's a really unique sort of turning point. And I think there's so many things that are on the docket and things that are being developed, and we just need that little bit more of a push and just to keep going down that track. So yeah, I'll stop there.
Thank you, Jeremy. This is the conclusion of this part of our webinar. I would encourage everybody to, this will go up on YouTube, I believe. That'll be there kind of forever. Feel free to go back through the presentation, write down the words, the definitions, what they mean, these questions, and really think about what you as a parent or caregiver may be comfortable with in terms of talking to your child's doctor. With that being said, we're gonna now I'm gonna stop sharing, and Alex will share, and we're gonna hear from Jenna from the NBTS and the wonderful educational resources that they have. So I'll go ahead and turn it over.
Thank you so much, Andrew, and for Jeremy and sharing Marin's story. As Andrew said, I'm Jenna Tazi. I oversee our community programs at the National Brain Tumor Society, including our public health campaign called My Tumor ID, which we will talk about now. So in 2024, we launched a brain tumor specific public health campaign called My Tumor ID, aimed at prioritizing education in two key areas: biomarker testing and clinical trials, knowing that these two very complex topics exist in brain tumor care. To highlight what Andrew and Jeremy mentioned earlier, brain tumors are complex, and biomarker testing is really key to understanding the molecular and genetic makeup of a brain tumor. This information can provide critical information about your child's diagnosis, the prognosis, and available treatment options, such as targeted therapies, as Andrew mentioned, or the possibility of participating in a clinical trial. While this public health campaign aims to educate families, we are also engaging providers by offering tools to support conversations about biomarker testing and working with payers and policymakers to remove barriers, hopefully making biomarker testing a standard part of every brain tumor diagnosis. With the support of our affiliate program partners, like the Pediatric Brain Tumor Foundation, we are furthering our mission to provide patients and families with clear, easy to understand resources. As our logo states on the screen, our goal is to help you identify your child's biomarkers, understand and identify potential treatment options, and feel confident in making informed decisions about your child's care. Next slide, please. Throughout our website, mytumorid.org, you will find universal resources about biomarker testing and clinical trials in both English and Spanish for families and providers. These tools are here to help you feel confident speaking up for care that follows current treatment guidelines. So we provide a glossary of key terms, some of the terminology that Andrew mentioned today, common medical words and phrases you're likely to hear at your child's appointments, along with clear definitions to help you feel more prepared. We offer a list of key questions, like you previously just saw, that you can print out or keep on your phone to guide conversations with your child's doctor, wherever your child is in their treatment journey, if they're newly diagnosed, facing a recurrence, or years down the line. Like how Jeremy shared Marin's story, we share patient stories through social media and blog posts to highlight the real-world impact of biomarker testing. We interview leading experts and share blog articles designed to help you navigate your child's brain tumor journey, always trying to highlight patient assistance resources when they are available. And lastly, we create short videos that make these complex topics hopefully easier to understand. Next slide, please. And as we know, there may be some providers and healthcare professionals on this call, we've created tools to help you too, to help introduce biomarker testing in your clinic. Our My Tumor ID poster, as you can see on the screen here, is designed to open the conversation with families, and our educational resources can be shared to help patients better understand their options. We want you to have the tools you need to make informed decisions that are right for you. And we hope these resources help you have timely and informed discussions with your child's healthcare team. Please know we're always adding new content and resources to the My Tumor ID campaign website, and we encourage you to sign up to receive the latest updates. So now, without further ado, I will transition over to the Q&A session of this webinar.
Thank you, Jenna, and thank you, Jeremy and Andrew, for the conversation today, the education, and just the honesty about your journey as well, Jeremy, and what you've experienced. I think it really does highlight where science has gone over the last decade through your real life experience. So thank you. I am going to start with Andrew on this question, and I'm going to see how many we can get through here. But if tumor tissue is not possible to obtain due to location of the tumor, is there any other way to test for any of the biomarkers?
Let me get off mute. Yeah, this is an absolutely wonderful question. Because as I mentioned, there was one of the slides I showed that was discussing the process of the biomarker testing. And I used the words, if possible. And you can go back and see that. And those words are important because it's not always possible to access that tumor depending on where it is in the brain. And so, and that's either through surgery or even through biopsy. And the reason is because it can be dangerous. And there can be a high risk of trying to get to where the brain is, considering it's in the brain. The brain is quite important. And so the question is there a way to understand what biomarkers may be in that tumor if we're not actually able to cut it out with surgery or access it through biopsy? Some treatment centers are able to look at different potential biomarkers in a tumor through a special kind of biomarker testing called liquid biopsy. Now, this is not something that we talked about in the presentation today because it's almost its own topic to have a presentation about, but it is worthwhile, I think, to ask your child's doctor about. And like I said, there was another slide that I showed that talked about the different ways that biomarker testing was done at one treatment center versus another treatment center. And that's what I mean by not all treatment centers are able to do this kind of testing. And so that's why it's important to have that conversation with your child's doctor.
Okay, thank you. Jenna, I'm going to ask this one to you. Just listening to you talk about My Tumor ID, one of the questions we had come in is pretty specific, but I want to know if My Tumor ID would be able to help this parent. What kind of biomarkers would you look for in pineoblastoma? Is that something that My Tumor ID could guide this parent in and provide the information needed?
That's a great question, Heather. And yes, that will be some of the information that's coming soon. We will be wanting to educate the public on specific biomarkers related to specific tumor types. So more to come.
Wonderful. Thank you. Andrew, can biomarkers change over time?
I love this question. This is a very important question. And thank you to whoever asked this. The answer is that it depends on the type of tumor that's developing, but it is possible for some biomarkers to change over time. And I think it's important to clarify what we mean by change. And so the reason that we say change is that sometimes, depending on how long the tumor has been growing, or what kinds of different treatments that a child has been on, for instance, if they've had, whether they've had a total resection or a partial resection where there's still some tumor tissue left over that the surgeon wasn't able to take out all the way, and then they've had different types of medicine, it is possible that there's new biomarkers that develop over time. And so if there's an opportunity, if it's possible to do biomarker testing later, if the tumor starts to grow again and they are able to either do surgery or biopsy, that biomarker testing may identify new biomarkers that have developed over that time. So it is possible. But usually the biomarkers that you tend to find in the original tumor, you'll also see in the regrowth of the tumor. It's just that you might see new ones that kind of like pop up. So great question.
Piggybacking on this, and I think you touched on it a little bit. So the question is, how many biomarkers exist for brain tumors today, which is a giant question. But the second part is what I love, and I love Jenna and Andrew to speak into, and even Jeremy, I think you touched on this. Are there likely still some that we have not yet discovered?
Jenna, you go first. Go for it. Let's see.
Most certainly. This is why this area and topic that we're talking about today is so important. The more research that goes in to biomarker testing, the more we are going to explore and the more that may show up. And I think, as Andrew said, just for example, the H3K27M mutation that was, I believe, discovered around 2010, 2011, has a recent FDA accelerated approval targeted therapy for it. So the hope is really that we do uncover more biomarkers and more research goes into finding targeted therapies specific to these biomarkers.
Yeah.
And take it away, Andrew. Anything else?
I couldn't agree more. How many biomarkers? There's a lot. There's a lot of
A lot.
biomarkers. But I think what's important to say to what Jenna said, that the reason that we know about those biomarkers is because of research. It's because of scientific research and clinical research, and that has to continue. Are there biomarkers that haven't yet been discovered? Yes. The biology of brain tumors is very complex, and today there's countless scientists and researchers right now across labs all across America and the world that are doing everything they can to find those new biomarkers for pediatric brain tumors. And they will find them. And as we find them, then we can begin to think about what kind of medicines might be used against them. So it was a wonderful question.
So you touched a little bit in your presentation on the difference between the biomarker testing and genetic testing. So the question is genetic testing done on the tumor itself or on the blood work of the patient?
So in general, genetic testing is done completely separately from the biomarker testing. So they're not one and the same. And this is why it's so important to have that conversation with your child's doctor The genetic testing part will usually involve a genetic counselor and other care team members. That's very different from just seeing what's happening in my child's tumor. And
Mhm.
so I think that underscores the importance of making sure that you understand when your child's doctor may talk about testing, which one are we talking about here? Is it one or the other or both? So it's very important to have that conversation.
So there's a couple questions in here that are specific to tumor type and whether all tumors are considered cancer. But I think the one question that strikes me the most is, does this testing work on non-cancerous tumors?
So this is a really interesting question. I think does biomarker testing work? So the purpose of biomarker testing is just to say, is this particular biomarker in this piece of tissue?
Mhm.
Okay. Whether it's an advanced tumor that maybe has come back and started growing again, and now your child had to have surgery to have that removed, or whether it's that tumor tissue that has just started developing and now, like when Jeremy mentioned in 2016, when they found out originally that Marin had that tumor, it's still tissue. And so even if it's what we would call maybe potentially a benign tissue or not benign tissue, you can still have it tested. The question is, for you and your child's doctor, of course, what kind of testing is most appropriate? And what is it going to help us understand about this? And so I think that's why it's so important to ask those questions to make sure that the purpose is there. And then if the purpose is there, how is that going to potentially help us understand a specialized treatment plan?
Um, I know this one, but I would love for you all to answer this one. Can tumor types change over time?
Yeah, I'll take a stab at this one. Yeah. So again, another wonderful question. In some situations, they can. So in some situations, you may have a type of brain tumor that's considered maybe a low-grade tumor. And then over time, it's possible that that low-grade tumor can turn into a type of a high-grade tumor. And so that does happen, and it doesn't happen with all tumor types. So it does happen with certain tumor types and not necessarily others. And so from the perspective of the biomarker testing, this is a perfect opportunity to ask your child's doctor about that testing part of it. And so if the tumor has come back and it's possible to have a biopsy, or if your doctor wants to have surgery, you have an opportunity to have that conversation around testing to say, okay, what are the biomarkers that may be identified through biomarker testing in this new tumor? So it's a wonderful question.
I can just add that
Yeah.
that situation did kind of come up with us where I mentioned this a little bit, but the surgeon was really um, pushing surgery because of this little chance in because her tumor does not normally upgrade, which is the low grade turning into a higher grade. That tumor type doesn't generally doesn't do that. I can tell you that scared the crap out of us when we heard that that might be a possibility, um, and that sort of like pushed the surgeon the decision to do surgery over the sort of finish line. It was kind of like the worst that happens is we get this out, we determine that it's actually something higher grade, but now it's out of your kid's brain versus we leave it in, we continue to let it grow because she was asymptomatic on the second time around. And it's actually something that has transformed into something higher grade. And again, I do want to say, and Andrew, I don't want to like um, question what you're saying at all. I just, what I've heard is that that can happen, but I just want to say that I've heard also that it's very, very rare to change the sort of malignancy of a tumor. If it grows back, there's more of a likelihood that something has happened. But just for those parents who might be like, oh my gosh, like I have to figure this out tomorrow and I'm going to call my doctor right now, or my child's doctor. I think it's rare. It can happen though. And again, I am not a medical doctor at all. I just saying that this all came into play when we were talking about the decision um, to do another surgery that I think is just important kind of context for our situation.
And Heather, I think there is also something here to highlight. There is a classification system that doctors, universally use called the WHO, or the World Health Organization's classification of tumors of the central nervous system. So this is a collection of information that helps doctors, based on this biomarker testing, right, classify a child's tumor. So if you are concerned about your child's tumor changing, or, I think something to do is ask your doctor, does my child's tumor have a classification based on, the standard guidelines that exist already? And hopefully that there could be a change, based on these guidelines change over time as research advances. So I think that's also something important to note.
Thank you. So we're coming on the end of our time. I'm going to squeeze in one more question here because I think this is an important one. Can there be multiple biomarkers in one tumor?
I'll go ahead and take that one. This is going to be probably not a satisfying answer, but there can be multiple biomarkers in a tumor. In some pediatric brain tumors, though, there tends to be a core biomarker, like a really strong driver biomarker. An example of this is that first example, pilocytic astrocytoma, that I had a slide about. We talked about BRAF. That's a really good example. So even though there may be other types of biomarkers identified in a particular pilocytic astrocytoma tumor, if there's a BRAF biomarker identified, that's going to be your strong core main driver. And that's not true for every type of childhood brain tumor, but usually there tends to be one really strong driver and potentially others that may be not as strong. And so it's a very good question, but the answer is yes, there can be, but there tends to be a primary one.
Thank you for that. All right, well, we're going to close out today. I want to thank the three of you so much for being with us. And I also want to thank our attendees for your participation and your thoughtful questions. Thank you to MBTS for assisting and putting this together with us today. We appreciate the partnership. The PBTF is here to help no matter where you are in the journey. So please feel free to reach out to us for support. The contact information is on this slide. We will be sending a link to the recording within the week, and we will also send the slides from today's presentation to everyone. As you leave us, please take a moment to scan the QR code on your screen and share your feedback on today's webinar, as well as topics you'd like to see on future webinars. Our webinars are always created from feedback we receive on topics that are important to families and their journeys. So we look forward to seeing you all again soon. Thank you. Have a great afternoon.